All ready to go.
Are you going to put the patient to sleep today?
I am. He's a little bit nervous about your age, but I reassured him that you have some skills.
I'm sure he's not the only one nervous today.
Warner,
You
a
guys
little
have
bit of
You
oxygen.
guys have a mask for me?
Right there.
Put that on your face, and then I'm going to squirt some drugs into that intravenous line. I'll be right here with you. You'll be sound asleep for the whole procedure. Unlike Dr. Sincerian, communication skills in anesthesia are sometimes limited because my patients don't respond, and I will frequently hear, "Nurse, he's not responding." Doctor, he's asleep. Ready for you. So for those of you who are not good communicators, you might like my line of work.
So you have phone you broke?
Okay.
So keep your hands. Laura, could you call the golf course, tell them I'll be back now?
Right.
I'd like a cheeseburger ready for them when I get there
Yes,
too.
Dr. Wallace.
Cheeseburger's not good for your gallbladder, doctor.
I already have mine now.
Sure.
I don't have one.
But we don't have.
All right. Give me your hand, bro. Right, we ready to go pre-operative antibiotics?
You're ready. Antibiotics are in.
Positive.
Those are gone. He's sound asleep.
Okay.
Show us your skills.
Let's go, Marcel. Come on, bud. All right, fantastic. Our monitor's coming along. He's coming out here, bud.
Actually, very good, very healthy, except for this gallbladder. So you have a chance to look like a hero.
Finally. This is a drink. Okay. Want me to kind of get this stuff set up, Marcel? You want to take a little break and do a little talking?
All right.
Let's see what I got here. It's perfect.
Got to get the scout, basically. That's kind of how everybody knows us. It's a very fun career field. It's very challenging. You get to see, personally, I do all types of surgeries, from brain surgery to dental surgery, like Dr. Wallace, to orthopedic surgery. So you get to do everything. It's a very versatile field, but you are working. So it's a pretty intensive job sometimes. Very rewarding. You get to see that the patients are better when you're done, and you made a difference, which is a big problem for me. I wanted to make a difference, and this is the job that will do that for you. There are many colleges that offer the courses, many trade schools that offer these courses, so just look into it, and it's an awesome career field.
Artery. It's covered by a bunch of tissue. I can't tell what the heck is what. Give me some electric powder. Give me some heat on that, Marcel. Crank it up, baby. All right, let's go. Okay, let's go. Let's break down these attachments. There's a duct in here somewhere, I'm pretty sure. That's what the manual said. There we go. Little cookie. Stay focused, Marcel.
Look like your cheeseburger,
A
sir.
little blood there, Marcel. Don't pass out on me again. It was
I
funny.
got some steak right now.
It was funny the first couple times. Okay. All right. So now we're opening it up. There's pretty much going to have the cystic duct and cystic artery open up pretty soon. Use this electrocautery energy to stop the bleeding and coagulate the proteins. Smooth that around. Looks like he's breathing here a little bit, Dr. Skinner. Are you back on the anesthetic?
Yeah, just relaxing.
Don't hurt. Don't hurt.
Get it a little deeper for you.
Okay, thank you. Take the back side. All right, things are starting to open up. That's a lymph node that I'm pushing up. Node of Callot in that area. Those 100 hours of anatomy weren't wasted. Well, not all 100 at least. Okay, let's clean this up a little bit more. These structures are going to be coming into place pretty soon. You have a clip of plier ready for me, Marcel?
Ready to go?
Perfect. You have a closing suture ready?
Ready to
I'll
go?
need 2 OPDS, 3 OPDS, 4 Monaco. You have that?
Sure.
Got everything, Marcel?
Great.
Got it all ready.
Perfect. I'll use 40 cc's 4% marquee. You have that?
Got it?
Okay. Oh, let's spread this. There's a duct in here somewhere.
Marcel.
Let's go.
Corner, midfield.
Perfect. Good, Marcel. Come in with the camera. Not bad. Come in. Okay, good. Nope. Yeah, there you go. Good, thanks. Scoot down a little bit. Move it up. Yeah, okay. Great. Just be a little patient here. It's all going to open up pretty soon. A little spready. Come on, there we go. There we go.
Doctor, I think you are getting
I
there.
feel like I know what I'm doing here. All right.
You are.
Try some lymphatics here. You got the scissors ready? Ready to go. Okay, it's down. Ready to go. Smooth things around.
That's like that. You are getting better.
No bleeding. Looks pretty good. Marcel, don't let go of it. Yeah. Don't worry, I'm only operating. Jeez, Marcel. Come on, buddy. Okay, here we go. Cuddy.
Well, how much longer are you gonna be? We got another case to go.
5 minutes.
All right, 5 minutes.
I was prepared to talk about general vascular surgeon, what it means to be a surgeon in surgical residency, but I'm sure most of you guys have seen Grey's Anatomy.
Yep.
That's pretty much it. So, Grey's Anatomy is nothing like being a surgeon or surgical residency. Probably the time in the cafeteria and the lunchroom is about the only thing that's consistent with being a surgeon, other than the fact that our lives are dedicated to helping people. So let's see, I'll give you my story. I went to high school in Anaheim. I wanted to be a physician ever since I was 6 years old. I have documented proof of that since I was 6 and 10, saying I wanted to be a surgeon or a rock star. So I tried my hand at the rock star thing. I've been in a couple bands, and that didn't pan out
And you see the OR?
badly. But after forced audience, no one could leave, so it's actually not bad. So I went to the university. I went to UC Riverside with the thought that I'd be a physical therapist or I would be a physician. And the pre-med requirements were just incredibly stressful and demanding and difficult. And I remember I had an academic counselor, and he goes, I was getting, at that time, A's, B's, and C's. And he goes, let's face it, he goes, you're a B student. If you go to class, you do what you want to do, you're going to get B's. If you try really hard, you're going to get A's. If you don't do the right thing, you're going to get C's. He goes, B students don't go to medical school. So that was the perfect thing that he could say to me because he just pissed me off. And I had pretty much straight A's for the last 2 years of my undergraduate. I did a year of surgical research. I actually did earn my EMT license while I was in college and undergraduate. I worked in an emergency room, and it only solidified my conviction to be a physician. Year after college, before I went to medical school, I did surgical research. I actually did some operating, and performed as an OR tech, similar to Marcel, for surgeons, and I knew at that point I wanted to be a surgeon. Medical school is very difficult to get in. It's a very tough road, and you have to make a lot of sacrifices, but medical school is pretty fun, and I would say once you get in there, it's very supportive and nurturing. From there, I knew that I wanted to be a surgeon. I did 6 years of surgical residency. I worked about 80 to 100 hours a week. I spent about every third night not sleeping, up all night, taking care of patients and traumas. That was incredibly difficult. That has since changed, and it's much better. There's an 80-hour work week, but that's a limitation. But that's essentially 2 full-time jobs. I then became a surgeon at the age of 32 at Saddleback Memorial. I've been here for about 6 years. I'm currently the chief of surgery. I would say find a job that you love and never work a day in your life. I love my job. I would probably do it for free. Don't tell anybody that. I basically lived like a college student from the age of 18 to the age of 32. I rented rooms. I lived in small houses. I drove old cars. I ate a lot of pizza. And I would not trade any of it. And I love my job. I love what I do. So my advice to everybody here, if I had to say one thing about, so I'm a little biased, I believe that the healthcare industry is the best industry. I also commend all the teachers that are here today. It's basically a field where we give back. At no point in my life will I ever look back and go, God, what did I do with my life? Well, I spent my life helping people, even as a medical student and a resident. Even though you feel like a student, I was helping people. And I will have no doubts and regrets. The other thing that I will tell you is people would often say to me, wow, you must love school. You must really love books and reading. Not really. I don't really love reading and studying. I'd much rather play the guitar or go out and play basketball or football. But I love helping people. And I had enough vision to know that if I was going to be successful in life and I was going to do the things that I wanted to do, I had to work hard. from the age of 18 on, and my hard work has paid off. I mean, every day is a great day for me. I love everything that I do. Operations are fun. I mean, operating on people is a fun thing to do. I now get paid a lot of money to do it. And most of my patients, if not all of them, are very grateful. So my advice would be to study hard, research the things that you want to do. When I want to be a surgeon, I spent time in the ER, spent time in the operating room, I did surgical research. I knew when I went for residency, I said, hey, I know what being a surgeon is. I've done on-call, I've done research, I've worked with surgeons. It's a nightmare, but I love it, and that's my nightmare. That's what I want to do, and I was highly recruited from all surgical residencies. Even though maybe on paper I wasn't the best candidate, I knew exactly what I wanted. So I encourage all of you to pursue your dreams. If you're not going to work hard, you're going to work hard at some point in your life if you're ever going to be successful. And choosing a career where you help people, I don't think you'll ever have any regrets at any point in your life.
I will tell you that the physician track will take you 4 years of undergrad, 4 years of medical school, an internship, and then depending on what you like to do, 3 to 6, 7 years until you're finally working. Is it worth it? Absolutely. It's the best job in the world. I had no intention of ever being a physician, but I am certainly the most pleased that it wound up this way. I would tell you one thing. For any Mr. Grumps out there, this is not the field you want to be in. You need to look people in the eye. You need to have a compassion, a way about you that you love dealing with people. And in our profession, sometimes these people they're hurting, they're not feeling very well. They're not at their best, but it's up to you to be at your best. I would tell each and every one of you, look at the healthcare profession. It's a wonderful industry. I hope to see a lot of you in it. Thank you.
He's feeling okay for a while. We did have to put a catheter in his bladder while he was asleep, so he's going to want that out pretty soon, I'm sure.
Okay.
Here, I'll put that one up for you over here. Okay, so Mr. Warner, I'm leaving you to Linda now. All
Mr.
right?
Warner, you're in the recovery room. Surgery's over.
Oh, good.
How are you feeling right now?
Where are you?
Yeah? Okay.
I can't find your other lead, sorry.
I'll try
and
to help you.
focus.
It's hiding under the gown there. I'm just going to get your vital signs, Mr. Warner, and take a quick listen to your lung sounds.
I'm going to get him some more blankets when I do.
Okay, great. Take some deep breaths. Mr. Warner, are you feeling short of breath at all?
Maybe a little, so soon after anesthetic, I'm not sure.
Okay. You know, I hear some wheezing in your lungs, so I'm going to call the respiratory therapist. Okay.
All right, I'm going to take off now, Mr. Warner. You take care of yourself, and I hope you feel better really soon, okay? All right.
He's down the street. Hey, Mr. Warner, how's it going?
Could be better.
You've been through a lot today, huh?
Been a busy day.
I understand the doctor took a pretty good boulder out of you.
I've been saving that for years.
Yeah. Well, you get to keep it. So Nurse Linda tells me that you have a little bit of wheezing in your in your right lung. So the doctor wanted to get that taken care of before we can send you home, and we're going to put you on a little breathing treatment. Okay? Have you ever had a breathing treatment before?
No.
Okay. It's pretty simple. That's what the plan is. Any questions that you have for me?
No, not at this point.
Okay. Nurse, why don't you take a little listen again after he's finished his
Sure.
breathing treatment?
Okay.
We'll take a little listen and see if he's how that wheezing's done, if we've done our job.
I'm going to take some deep breaths through your mouth. Much better. Looks like the wheezing is all gone.
Okay, sounds good. So, okay, the medicine's worked. We're gonna get you ready for home. We'll go over that incentive spirometer again before you leave, just to make sure you know what to do with it. And the key is, even if you're not doing that little device, when you're watching television, every time a commercial comes on, take a deep breath. In through your nose and out through your mouth. Smell the roses, blow out the candles.
Okay.
Okay? All right, we'll talk to you a little bit later. If got any questions, Nurse Linda got my number, and she can get in touch with me.
Okay, thank you.
Okay,
Thank you very much.
Hi. Well, it's been a pretty good thing. Coming to work is a pleasure to be able to help people. And that's the key when you choose your profession, no matter what it is, if it's in the healthcare field or in any field, you have to feel comfortable and happy with what you're doing. So, what is a respiratory therapist? A respiratory therapist is a healthcare practitioner, and that's the key. Healthcare practitioner. We're helping people to be better. We are registered by the National Association of Respiratory Care. We're licensed in the state in which we practice, which could be any state. It could be California or throughout the United States. One of the other nurses taught respiratory therapy, which is kind of an exciting thing to be able to see different areas and still have a job when we get there. So what we might be considered to be the 911, or part of the 911 team in the hospital. Anytime that there's an emergency, be it what we call a code, we are responsible for taking care of the airway, the breathing and circulation. So we will respond to those, making sure that we have a good airway, because when people can't breathe, there's nothing else matters. We can do all kinds of miraculous things, but when those things go awry and we can't breathe, our brains go away in a very short period of time. So as respiratory therapists, that's what we try and take care of. Respiratory therapy is a relatively new field if you think about professions. Nursing profession. Nurse Linda, how old is the nursing profession?
Very old.
Very old.
1800s.
I'm going to get a little drink of water here, if you don't mind. Has only been around for 60 years. It was created, founded in 1946. So 60 years may sound like a long time to you guys, but it's not long as a profession. And so in that short period of time, we have moved very quickly into all different areas of medicine. And that's the exciting part of it. Let me just kind of talk about what the education is. There are many programs throughout the United States. When I first got into respiratory therapy, I lived in Louisiana. I had to travel to Denver, Colorado in order to go to school. But nowadays, there's respiratory therapy schools throughout the United States. As a matter of fact, our hospital here is affiliated with Orange Coast, and we have students that rotate through here, and we're real happy to accommodate that. But throughout the area, you can attend schools all over the place. Usually, you can go into an associate's degree program, a bachelor's degree program, as well as a master's degree in respiratory therapy, all depending on what you want to do. What's real exciting for you guys coming up in the field is that it's so versatile. At one time, respiratory therapists only practiced in the hospital, but nowadays we're involved in lots of different areas. We do patient care in hospitals, but we have the full spectrum as far as being able to deal with neonates, which are infants, newborns, with pediatrics, with adults as well. We work in pulmonary function labs where we test breathing capacities, and we do education. We're in the educational field as well. So it's if you have an interest in science, and you have that desire to help people, and if you have good critical thinking skills, this is the field to go into. It's exciting. Again, what do you think that, we primarily practice on patients that are see patients that have some type of underlying respiratory problems. We call it COPD, chronic obstructive. I think the bottom line here is that, in the end is that when you're doing something that you really love, that's the profession you need to kind of focus on or think about in some detail other than money and status and whatever. But if you're happy to go to work every day like Dr. Wallace so eloquently spoke of, then and anytime that you're helping people.
Oh, there's no bleeding. You're looking really good. I think you're going to get to go home soon. So I'm going to go ahead and start helping you get ready to go home.
Okay, thank you.
All right. How many of you out there are like Dr. Wallace and knew what you wanted to be since you were 6 years old or so? A few. How many of you have no idea what you want to do when you graduate? Okay, what category is everyone else in? I don't know. You sort of have an idea maybe what you want to do, but you're not completely sure? Well, I think that was me. When I was in high school, I knew that I wanted to have a profession that was meaningful. I wanted to do something meaningful with my life. So I said, okay, and I applied to the College of Nursing. That might not be the best way to go, but it was a good fit for me. And they let me in, believe it or not. I was a B average student, and it was fairly cut the line at only A students. They let some of us B students in also. So now it's a little bit more competitive, especially in our area for nursing. But if that's what you want to do, I encourage you to go into nursing because, as Lori told you, it's a very versatile career. You can get a degree, an associate's degree, and become a registered nurse. You can get a bachelor's degree and become a registered nurse. Now they have programs that you enter as a nurse with a master's degree. There's still things you can do in the hospital setting, but there's also a lot of things you can do outside of the hospital. You can work in a doctor's office. If you become an advanced practice nurse and get your master's degree, you can become a nurse practitioner. You can work in a clinic and see patients. You can write prescriptions there. You can, you see patients as a physician does. You don't have all the privileges of a physician, but you do have autonomy as a nurse practitioner. You can become a nurse anesthetist and deliver anesthesia like Dr. Skinner did today. That's a very exciting route to take in nursing. You can become a nurse educator, which is what I am now. I got my master's degree a few years ago, and now I work as a professor at Saddleback College, and that's very rewarding as well. You can get into politics and lobby for nursing, and there's just so many different things you can do as a nurse. So I encourage you to look at all the different routes that are there, and if you like nursing, go for it, because we need lots of nurses. The baby boomers are getting ready to retire, and there's going to be a big shortage of nursing, so there's going to be lots of jobs available for all of you. So go for it. Thank you. Okay, Mr. Warder, I'm going to lower the gurney so you can sit up, and I'll help you get into the wheelchair. Okay? Hold on, because this gurney is a little wild. Okay. I'm going to help you sit up. I'm just going to take it slow. Side. Just swing your legs around over to the left here. And just sit on the edge of the gurney for a minute and get your bearings straight. Okay, just sit there. Oops, our brakes aren't on. That's dangerous. All right, look straight ahead. Take some deep, slow breaths. And how are you feeling now? Any lightheadedness?
No,
No tunnel vision or anything?